Hey guys, this is Fixer Med. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 42 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content.
Let's start off by taking a look at superficial perineal pouch. It is comprised of the ischiocavernosus muscle, bulbospongiosus muscle, superficial transverse perineal muscle.
Let's next take a look at urine leaks. A crushing blow or penetrating injury can rupture the spongy urethra within the bulb of the penis, causing urine to leak into the superficial perineal pouch. The superficial perineal fascia prevents urine from spreading into the thigh or anal triangle. However, after distending the scrotum and penis, urine can travel over the pubis into the anterior abdominal wall, deep to the deep layer of superficial abdominal fascia. Let's next take a look at cystocele, or hernia of the bladder. Loss of bladder support in females, often due to pelvic floor damage during childbirth, for example, laceration of perineal muscles or nerve injury, can lead to the bladder protruding onto the anterior vaginal wall. When intra-abdominal pressure increases, such as during straining for defecation, the anterior wall of the vagina may bulge through the vaginal orifice into the vestibule. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 25-year-old male presents to the emergency department with perineal pain and swelling following a fall while playing sports. On examination, there is tenderness and ecchymosis in the perineal region. Which of the following structures is most likely involved in this patient's injury? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, superficial transverse perineal muscle. The superficial perineal pouch contains the superficial transverse perineal muscle, which is prone to injury during trauma to the perineal area. The patient's symptoms of perineal pain and swelling following a fall are indicative of potential damage to this muscle. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, ischiorectal fossa is incorrect because the ischiorectal fossa is a space located in the anal region and is not a structure within the superficial perineal pouch. B, deep transverse perineal muscle is incorrect because this muscle is located deeper and is part of the deep perineal pouch, not the superficial perineal pouch. D, bulbourethral, Cowper's glands, is incorrect because these glands are situated within the deep perineal pouch and are not part of the superficial perineal pouch. E, prostate gland is incorrect because the prostate gland is an internal organ and is not located within the superficial perineal pouch. All right, now that we have covered this question, let's move on to look at the next question. A 40-year-old male presents to the emergency department after a motorcycle accident. He complains of lower abdominal pain and swelling in the scrotum. On examination, there is tenderness in the perineal region and ecchymosis extending into the scrotum. What is the most likely cause of the patient's symptoms? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, rupture of the urethra. Following trauma to the perineum, such as in a motorcycle accident, the urethra can rupture, leading to urine leakage into the surrounding tissues. This can result in lower abdominal pain, perineal tenderness, and swelling in the scrotum due to extravasation of urine into the scrotal sac. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Rupture of the bladder is incorrect because while bladder rupture can occur with significant trauma, it typically presents with diffuse abdominal pain, distension, and signs of peritonitis, rather than localized symptoms in the perineal and scrotal regions. C. Testicular torsion is incorrect because testicular torsion typically presents with sudden onset severe testicular pain and swelling, without associated lower abdominal pain or perineal tenderness. D. Epididymitis is incorrect because epididymitis presents with gradual onset scrotal pain and swelling, often associated with urinary symptoms such as dysuria and frequency, rather than acute perineal tenderness and lower abdominal pain. E. Inguinal hernia is incorrect because inguinal hernia presents with a bulge in the groin area, usually reducible and may cause discomfort, but it does not typically result in acute perineal tenderness or lower abdominal pain. All right, now that we have covered this question, let's move on to look at the next question. A 35-year-old woman presents to her gynecologist with complaints of a sensation of pelvic pressure and bulging in the vaginal area. She reports worsening symptoms when standing for long periods or lifting heavy objects. On pelvic examination, there is anterior vaginal wall prolapse noted, with the bladder protruding into the vagina. Which of the following best describes the condition affecting this patient? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, cystocele. A cystocele, also known as a hernia of the bladder, occurs when there is a loss of bladder support in females, often due to damage to the pelvic floor during childbirth. This can result in the protrusion of the bladder onto the anterior vaginal wall, leading to symptoms of pelvic pressure and bulging. The worsening of symptoms with standing or lifting heavy objects is characteristic of cystocele due to increased intra-abdominal pressure exacerbating the bladder prolapse. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Uterine fibroids is incorrect because uterine fibroids are benign growths of the uterine muscle and do not typically cause anterior vaginal wall prolapse or bladder protrusion. B. Ovarian cyst is incorrect because ovarian cysts are fluid-filled sacs that develop on the ovary and are not associated with anterior vaginal wall prolapse or bladder protrusion. D. Rectocele is incorrect because rectocele refers to the protrusion of the rectum into the posterior vaginal wall, not the bladder into the anterior vaginal wall. E. Pelvic inflammatory disease, PID, is incorrect because PID is an infection of the female reproductive organs and is not associated with anterior vaginal wall prolapse or bladder protrusion. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.